We're still looking at some of the key issues as far as the general elections is concerned. In the studios with me today, we have Dr. Kayode Makinde, the president of the Association of Resident Doctors in Lagos. It's a pleasure having you on SaharaTV, sir.
Thank you very much, man.
As Nigeria moves towards the 2019 general elections, major concerns or major issues have been put or are on the front line, which Nigerians are actually concerned about. One of these major issues has to do with healthcare. How will you have assessed the state of Nigerian healthcare in the past 4 years?
Wow. Permit me to actually modify your question. The issue of health is very important to Nigerians, that I will agree with. But if you look at the political landscape and you look at the various campaigns across the nation, across the various political parties, I think I'm rather disappointed as to the level, okay, of importance assigned to health, okay. Let me give a vivid example. Here in Lagos State, the Nigerian Medical Association, Lagos State, organized a debate that focused on the health and well-being of the populace. You'll be shocked that the two leading political parties refused to turn up. And that puts credence to the fact, or it raises concerns, especially with professionals like us, that, okay, are these people really concerned about our health care? Now to the second part of your question. For the past 4 years, I would say the state of healthcare still remains the same, okay? We still have some of the worst indices of healthcare when compared to other countries globally. Infant mortality, maternal death, okay, nutritional status. Yes, in some areas there have been some improvement when it comes to immunization, okay. Increasingly, we are winning the war against polio, that I must say. But overall, I think I would say we've not really made tremendous progress in the last 4 years.
What do you think should be done to revamp or revitalize the healthcare system in Nigeria?
Wow, that's huge, because the healthcare sector is besetted with a myriad of problems, okay? So there's no silver bullet, okay? There's no one cap fits all. There are a number of things that we need to do. There are basic things we need to address, okay? First, that is dear to me, is the issue of universal health coverage, okay? Almost 70% of Nigerians access healthcare by paying direct out of their pocket, okay? That on its own influences the way they seek care, influences health-seeking behavior, okay? And only a few states, I think between 8 and 10, if I'm correct, have domesticated that act, okay? And even looking at the National Health Insurance Scheme, it's just less than 5% of Nigerians are covered. And there's no way you can guarantee affordable, efficient, and qualitative healthcare for the populace without having some form of insurance. So if anything, if I'm to choose the first thing that I think can actually influence healthcare service delivery through improvement in quality, it will be the global, okay, global coverage of the populace through health insurance. That will help. The second thing is we need to address critically, okay, the issue of brain drain, okay, not only among doctors alone, but across all cadre of healthcare workers. Yes, there are various factors, okay, but currently as we speak, there is what among medical doctors we call it the third great wave of brain drain. The first one was in the 70s, the second one was in the late 80s and 90s, and currently there's a great wave of migration going on. And the difference with this one, you know, in the past, people still wait for a few years before deciding to move. But now, immediately a young doctor finishes medical school, immediately after NYSC, they are out. And you need to look ahead. In the next 5 to 10 years, we'll start feeling the effects. Many people, because they stay in urban towns, Lagos, Abuja, Port Harcourt, they may not appreciate the situation of things now. But if you go to all the hinterland, all the smaller towns, you will know that, yes, this country, we are having a terrible shortage of healthcare staff. That needs to be addressed at that. And of course, thirdly, is, yes, it's not, you don't solve problems all the time by throwing money at it. But some problems can be solved when you appropriately fund it. Healthcare sector in this country is abysmally funded. I think the 2019 health budget, the allocation to health is less than 4% of the entire budget. This is absolutely, it's inadequate. It's inadequate, and I think we can improve on that. So let me just stop.
So considering the fact, in fact, based on your analysis here, One of the issues concerned has to do with the fact that there's brain drain, mass migration of doctors, and we've had instances where we've had resident doctors going on strikes, and this has put a lot of strain on the healthcare of the populace, patients groaning. I mean, one big question that a lot of Nigerians wonder is what should be done by the next administration, whoever wins the presidency, in order to put an end to the incessant strikes by resident doctors?
Thank you very much. I would disagree with you slightly. I don't think resident doctors have gone on incessant strike. And let me say this. In the last 4 years, if you look at the data and if you look at it,
but resident doctors have always been on strike. I mean,
we go on strike.
We go on strike. 2018, there was a series of strike. Not just peculiar only to Lagos State, but in other states of the federation.
Yes, I agree with you.
Since 2016, as a matter of fact,
there are key states, there are areas, there are some states that have significant challenges, especially when it comes to doctors, okay? But when you look at it holistically, at least I must say, we are quick to castigate the government. Do you understand? But in areas where they have done satisfactorily, I think it's important to point. I'm aware, okay, at least from the national perspective, that the present administration, they've tried. But
part of the reason why the resident doctors, in Lagos went on strike in recent time was because of unpaid salaries and allowances. In fact,
it was a local problem. It was a local problem. It was not a national problem. So, but that issue was also resolved. Although, yes, we had to resort to strike action after about 3 months, but it was resolved. But what I'm trying to tell you that if you look at it holistically, look at it from a national point of view, efforts are being made to ensure that, okay, the issue of strikes, okay, is a thing of the past. Because the truth of the matter is that we as resident doctors, we love our patients, we love Nigerians. It saddens us and it pains us for us to go on strike, okay? Because we know a lot of things can be destroyed, lives can be lost. Okay, even for those of us under training, our training is affected. So it's not as if we love going on strikes. Do you get it? Because that's I'm trying to explain when you use the word incessant. We don't love going on strike, but sometimes when you are pushed to the edge. But increasingly, we've seen more engagement with the appropriate authorities, and before issues get out of hand, we try to interface and dialogue over them. So, yeah.
One final question has to do with maternal and child health care in Nigeria. It has remained consistently dismal in recent time. What is being done, or what should be done to reverse this?
Yes, thank you very much. It's sad, despite the fact that Nigeria constitutes just about 2% of the world population, okay? We contribute about 14% of the maternal deaths globally, okay? We have one of the worst indices when it comes to that in sub-Saharan Africa and the world, okay? And there's no gainsaying that we need to improve on that, because one of the indices that can give you information about the quality of healthcare service in a country is how you take care of your pregnant women, okay? Now, I will give you an example. During the administration of Governor Mimiko in Ondo State, when he came on board, okay, a few years ago, Ondo State had one of the worst indices of maternal health, especially when you compare it to sister states within the western part of Nigeria. And he introduced a model which he tagged the BA model, which actually the World Health Organization gave kudos to, okay? One of the pillars, okay, some of the things that he did differently, I feel that if we can adopt them, okay, and scale them up and make it a national policy, it can actually help. Of course, there's a need to educate our people. We have problems, challenges with traditional birth attendants, okay? We need to actually improve our referral system, okay? Definitely not all pregnancies or not all women in labor will have a smooth deliveries. There are those, okay, that will require extra help. How do you move them from a point A to another point where they will need, where they can access proper health care? Arguably, the most important factor that influences the outcome of a woman in labor is referred to as skilled birth attendant, okay? That is somebody who has been trained to proficiently to manage that delivery, one, to recognize complications on time, and to either intervene, okay, or refer the patients. So one needs to put all these things in place. And when you look at maternal death, we divide it into three. We call it 3 phases of delay. You know, delay in seeking help, delay in getting to the point of care, delay at the point of care. So when you look at all, there are various factors which I may not be able to exhaust at this sitting, but when you look at all these issues and you put appropriate mechanism in place with appropriate funding and monitoring, then we'll begin to see. But we need to declare a national emergency personally, because I don't think it is fair for a woman, a pregnant woman, to die during childbirth.
Dr. Kayode Makinde, it's a pleasure having you on Sahara TV. Thank you very much.
My pleasure.